Do better.
Do better.
Thank you.
Save the ACA. Save the ACA. Save the ACA. Save the ACA. Save the ACA.
What?
Save the ACA.
What?
Save the ACA.
What?
Save the ACA.
What?
Save the ACA. All right, everybody.
Oh, now.
When? Now. All right, everybody. We are now going to hear from another champion, someone who is on our side, someone who tried so hard to force the Republicans and the MAGA in Congress to do something about the Affordable Care Act and to do something about these increased subsidies. Representative Delia Ramirez from the great state of Illinois is here. Congressmember Ramirez, thank you.
Thank you. I came in just in time as we were chanting, save the ACA.
Yes,
Save the ACA.
Yes, save the ACA.
And when do we have to do that?
Now.
When?
Today.
Right now.
Yes.
Not now, but now.
That's exactly right, like the real now. Because in Spanish, we have different nows. We have that ahorita in Spanish means like right now, but it doesn't mean right now. So we mean the inmediatamente, immediately right now.
Right now.
So folks, I'm Delia Catalina Ramirez. I am the Congresswoman of Illinois' 3rd Congressional District in the northwest side of the city of Chicago in the northwestern suburbs. And what I know is that my constituents sent me to this place, to the halls of Congress, to stand up for them.
Yes.
Not for corporations, not for insurance companies, not for pedophiles, and not for presidents.
Not for none of them.
And I think it's really important for us to be clear in this moment. Why are we here? Who sent us to Congress? And if you were sent by the people, and I think most of us were, although actually some were not, and they've shown you their votes, but if you were sent here by the people, then there's no question, there's no hard vote. You're either going to protect health care or you're not. There's no in-between in that moment.
No in-between.
Because the idea that someone has to choose between going to the doctor and paying rent is unconscionable.
Shame.
The idea that someone right now is going online and trying to figure out, I barely could do it when I was paying $600 a month in the ACA for my family, barely making it. And now they want me to pay $1,800? You know what ends up happening? People stop paying for insurance, they stop going to the doctor, and people die.
Yes, they do.
Every single person that ends up having to make this choice, my colleagues in Congress will have to wear the jacket when they die.
Yes.
But here's the thing, we can stop it today.
Now.
We can make it possible. Now here's another thing. No one really knew what discharge petitions were before, right? I was in the state legislature. I didn't know what a discharge petition in Congress was. And sometimes they used it, but generally it wasn't a thing that actually moved.
Right.
People made a statement, some people signed it, but it's hard to get to 218.
Yes.
A couple of days ago, we got to 218 signatures to release the Epstein files. Showing us that when we organize, when we are together, when we put people over profit, discharge petitions work.
Yes.
So here's that part right now. We need 218 members of Congress who have courage, members of Congress with spine, members of Congress that care about health care, care about their families, and care about their constituents to sign the darn petition, and they gotta sign it right now.
Right now.
Because what we need in this moment is to extend the ACA immediately.
Save the ACA. The ACA.
Save the ACA! Save the ACA!
What?
Save the ACA! What? Save the ACA! What? Save the ACA! Okay, you got me going. And I gotta go.
Don't leave.
No, I'm gonna go do more work. I got a hearing.
Yeah.
Because the other thing we gotta do is we have to hold ICE accountable too, right?
We do.
I'm about to go do that in a minute. But let me wrap up in saying this. You all are here on a very cold day.
Yes.
You shouldn't have to be here fighting for something that's so basic as healthcare.
That's right.
And yet we are here. And I want you to know that your presence here is more important than ever. Thank you for showing up. Thank you for the sacrifices that you're making to be here in this precise moment. Because I understand that when you put the pressure, when you put a face behind that petition, behind that bill, behind that text, the world sees what we're fighting for. And we have to fight for healthcare to truly be a human right in the United States of America. And I'm going to make that fight my living fight with you. We're going to get the petition to 218 signatures. We're going to protect healthcare, and we're going to do it together because the people united shall never be divided. Divided or defeated? United shall never be defeated. The people united shall never be defeated. Let's go! Save the ACA!
What?
Save the ACA!
What?
Save the ACA! When?
Save the ACA!
Now!
Save the ACA!
Now! Now! All right, everybody!
Now!
We need 218. We got a few members of Congress with us who do have some courage, who have been standing up, who have signed that discharge petition, who have done everything that they can, but they're going to do more to make sure that we save the Affordable Care Act. And we're very fortunate to have with us today Congressmember Espaillat from New York, who is chair of the Congressional Hispanic Caucus.
All right. Okay. I bring you greetings from Harlem, from Washington Heights, from Hamilton Heights, from the Northwest Boogie Down Bronx. This is an important fight. This is a fight about life and death.
Yes, it is.
This is a serious fight
Yes, it is.
about life and death. There are 23,000 people in the 13th Congressional District of New York whose life depends on the ACA credits.
Yes.
Now, these are people that suffer from diabetes, and they need that insulin. These are seniors that may have respiratory diseases, and they need that help. These are men and women suffering from cancer, children with acute asthma that need health care to survive. That's why this is a fight about life and death.
Yes, it is.
Right. And so when it gets to here, the Congress of the United States of America, we must push to ensure that we save the ACA.
Save the ACA.
That the ACA continues to be the avenue to life and not death. That the ACA continues to be people's ability to be able to pay those premiums. That the ACA continues to build and provide the health care that families across America need. Now, God knows they already try to perpetrated severe cuts on Medicaid.
Shame.
They try to perpetrate severe cuts on SNAP.
Shame.
But this is a fight about life and death, and the ACA is the only avenue we have for life.
Yes.
So we must fight every single round. We must not stop at any stop and continue to move forward until we save it. Now, we know that since he came to office, they've been hell-bent on trying to destroy the ACA.
Yes, they have.
Every single year, they go at it.
Every year.
Because they know that this is a fight about life and death, and they choose death
They choose death.
right.
over life.
choose death.
They choose death over life. And so I thank you all for being here. An important fight, and in many ways, this is a fight about the soul of America, because no family in America should be worried about dying as opposed to living. It should be a no-brainer. It should be an easy decision for everybody to make.
Yes. Yes, it should.
So when they choose the big insurance companies, when they choose the pharmaceuticals, when they choose profits over life, they're damning their soul.
They're killing us.
And they're trying to kill us.
Yes, they are.
So they're trying to kill us. We're going to fight to the bitter end, not to die. We choose life over death.
We choose life.
And so we choose life. We choose life. We choose life.
What?
We choose life.
What?
We choose life. So thank you so much for being here today.
Yes.
The neighborhoods that I represent, iconic neighborhoods in the United States, Harlem,
Yes.
the capital of the African diaspora in the world.
Yes.
Washington Heights,
Yes.
an immigrant community that wakes up every day dreaming of a better life.
Yes.
And the Boogie Down Bronx, a working class neighborhood that refuses to stand down. These neighborhoods are in this fight.
Yes, they are.
We probably got more hospital beds than any other district in the country. We got Montefiore Hospital. We got New York Presbyterian Hospital. We got Harlem Hospital. We got Mount Sinai Hospital and several other small hospitals and about 18 federally funded clinics in the district. In fact, the district became the center of care during the pandemic.
Yes.
Yes, it did.
That's why the emergency workers came to every day, put their lives on the line to save families. And now they want to imperil, they want to crucify, they want to end ACA, and we won't let them do that. Because ultimately, this is a fight of life over death, and every single time
Choose life.
we choose life.
Choose life.
For our children, for our families, for our seniors. We choose life, and we won't back down. God bless you, and keep the faith.
Save the ACA!
What?
Save the ACA!
What?
Save the ACA! All right, everybody. I was a foot soldier in the fight to actually win the Affordable Care Act. And I remember the bad old days. When I graduated from college, I just didn't have insurance. I didn't earn enough. I was young. I took my chances. And that's what everybody I know did. And some of us would get sick. We would have an accident. And our families and ourselves would be faced with devastating financial consequences. Sometimes we would lose our lives. People my age would lose their lives when they didn't have health insurance. And when we won the Affordable Care Act, suddenly there was an opportunity to be able to purchase affordable health insurance. It was a good idea. There's so many good policy ideas. Right now, when you're so many people, we heard, work at places like Amazon. They're working 2-3 jobs, and they still can't afford health insurance. That ain't right.
No, it's not. That's not right.
And now we are looking at a time when tens of millions of people in this country will go without health insurance. And I'd like to introduce someone who has been pushing for ideas like having kind of a universal basic income where people can actually get some money in the door, let alone some health insurance. I'd like to introduce the executive director of the Economic Security Project, Taylor Joe Eisenberg.
Welcome.
Get it.
We are in an affordability crisis.
Yes, we are.
Rising costs of groceries, housing, childcare, utilities, and yes, healthcare are squeezing American families, putting them over the edge. The absolute last thing that millions of Americans can afford right now are even higher healthcare costs. But that is exactly what congressional Republicans have given us. When Republicans in Congress passed H.R. 1 this summer, they ripped healthcare away from millions of people and sent bills through the roof for everyone else.
Yes.
And they didn't just do it. Didn't just pass the biggest healthcare cut in history. They also delivered $1 trillion in tax cuts for billionaires and big corporations.
Yes.
We are only beginning to understand the horrific impact of Republicans' healthcare cuts. But we do know that over 22 million folks on the Affordable Care Act will feel it first. Health insurance costs in 2026 alone will go up over $300 more on average per month. Those are not pennies. Those are people's groceries. Those are their car payments.
Yes.
These are the people least likely able to absorb these higher monthly costs. The ACA is the only healthcare option for folks like small business owners operating on tight margins, server workers making tipped minimum wage, or people like farmers, ranchers, and construction workers. They're also getting crushed by Trump's tariffs. Congressional Republicans are forcing these folks into impossible choices. Working families cannot afford to pay twice as much every month. As a result, over 4 to 5 million people are expected to drop coverage because they can no longer afford it. Others who can't afford that choice because they need life-saving medications, treatments, regular screenings, will have to make sacrifices that no one should have to make. I know a little bit about what that sacrifice looks like. When my mom was diagnosed for stage 4 cancer, the Affordable Care Act was the reason she was able to access affordable health care after receiving her diagnosis. A technicality resulted her in losing that coverage, and she spent the final months of her life not prioritizing comfort or time with her family, but skipping doctor's appointments and stressing about whether she would be able to stretch the money until the end of her life.
Shame.
Terrified that she was going to leave her family, her daughters, in debt. She and I will never get that time back. No daughter, no mother, no family member should ever have to fear that future for their loved ones.
No.
Yet my mom's heartbreaking story is about to become all too common. The healthcare system in this country was already broken.
Yes.
We need our healthcare leaders to stand up to this health insurance CEOs that are ripping us up.
Stand up.
Instead of cutting their taxes. We need them to lower healthcare costs right now. And we're in the middle of an affordability crisis that's pushing the American dream even further out of reach. And long term, we need to fix the system and prioritize public health over private wealth. It is what we all deserve.
Yes. Yes. Save the ACA. Yes. Save the ACA.
What?
Save the ACA.
Now.
Save the ACA!
Now.
Save the ACA!
Now.
Save the ACA.
Now.
Save the ACA.
All right, everybody, it's my honor to introduce someone who has fought for the Affordable Care Act, who's helped us lead the people-powered movement to save the Affordable Care Act, the first Trump administration when they promised to take it away. I'd like to introduce Rob Weissman, co-president of Public Citizen.
Yes. Big Rob.
Yes.
See him in the back. Big Rob.
Hey, y'all. I'm gonna pull this off. Donald Trump and congressional Republicans suddenly, hysterically, say they're worried about health care affordability.
Lies.
I thought we should talk a little bit about health care affordability.
Yeah. Let's do it. About it.
The first thing is, if you don't have insurance, healthcare is not affordable for you in the United States of America.
That's right.
So if you're stripping away health insurance from 17 million Americans, you're making healthcare unaffordable.
That's right. That's right.
And we know what happens when people don't have insurance. We know what happens when healthcare is so unaffordable you can't go and get healthcare. These coffins,
Yes.
they're not jokes.
That's right.
That 51,000 number over there,
Yes.
that's not a guess.
Yeah.
That's a certainty.
Yes.
Every year, not once, every year, 50,000 people are going to die because of the Medicaid cuts and the ACA cuts that Trump and the Republicans are trying to force on us. 51,000 people every year.
Every year.
That story we just heard from Taylor Joe, 50,000 times.
Yeah.
Every year.
That's right.
Every year.
Every year.
And it's not like the country saves any money.
No.
We all still pay, right? The people who are sick pay. They just pay by being sick and sicker. They don't get preventative care. They don't go to the hospital when they need to in the first place. They deal with it. And when they do go, they pay more than they would pay if they had health insurance in the first place.
That's right.
The system gets poorer. Rural hospitals are going to close in huge numbers because of these cuts.
That ain't right.
40% of community health clinics are going to close because of the cuts to Medicaid and the ACA. It's not about affordability. It's not about affordability. It's about something else. It's about something else. The second point is, we as a country can afford to take care of each other. We can afford to provide Medicaid coverage. We can afford to pay for the ACA subsidies. We know that because we were just doing it. We know that because we were just doing it. But I think we got to say this. They didn't just cut it because they're mean. They are mean. They are mean. That's not why they cut it only. They cut it. Where'd my sign go?
Here.
Where'd my sign go?
Yes, tell it.
Right?
Tell it. Look at his son.
The billionaires got richer. They cut health care from low-income people to provide tax cuts to billionaires. Tax cuts to billionaires. So can we afford it? Yeah, we can afford it. They just took the money from poor people and gave it to rich people. We didn't save anything. They took it from poor people and gave it to rich people. Right? It's the opposite of Robin Hood. It's the opposite of Robin Hood. And people are going to die so they can make Elon Musk richer, so they can make Jeff Bezos richer. The third thing we need to say about affordability in healthcare is healthcare in America is not affordable. It costs way too much.
It does.
Some of that we can't help. People are getting older. Society's got to spend more money on healthcare. But it costs too much over and over again because corporations are ripping us off. For-profit companies are charging too much for emergency services. The drug companies charge too much for pharmaceuticals. The health insurance companies rip us off every which way. So we can save money if we're worried about affordability. If we lower drug prices so we pay just what other rich countries pay, we'd save $200 billion easily every year. $200 billion every year. The way they count over here, that's $2 trillion because they count by tens. $2 trillion. If we got rid of the rip-offs from privatized Medicare Advantage, $100 billion every year. $1 trillion over 10 years.
That part.
So if we want to say, hey, you know what? We need to lower costs and we need to expand care. People who have Medicare should have their hearing covered. They should have their eyes covered. They should have their dental covered. They should have home health care covered. We can pay for that by stopping the drug companies from ripping us off, by ending the insurance companies from ripping us off.
That's right.
And let me tell you this, because I know you know this. You know what would save the most money in health care? What would save the most money in health care is making sure everyone had health care. A Medicare for all system. A Medicare for all system is the way we achieve affordability.
Yep.
So,
Take your time, Rob. Take your time, bro.
don't worry, brother. Health care is a right.
Yes, it is. Yes, it is.
Health care is a right. That we hold these signs here, what a disgrace.
What a disgrace. Yes.
Richest country in the world.
Shame.
Saying we're going to transfer money from poor people to rich people, let 50,000 people a year die, make 20 million people a year pay double the cost for insurance.
Criminal. Criminal.
Is health care all right?
Yes.
Health care is all right?
Yes, it is.
What's your chant here? Fight, fight, fight.
Right.
Fight, fight, fight. Health care is all right. Fight, fight, fight.
Healthcare is right.
Fight, fight, fight.
Healthcare is right.
Fight, fight, fight.
Healthcare is right.
Thank y'all.
Great job. Healthcare is right.
Rob.
Great
Thank you.
job.
ACA! Save the ACA!
I like
Save
that.
the ACA!
Save the ACA.
Save the ACA!
Now.
They tried to take away the Affordable Care Act before in the first Trump administration, and it was some of these folks, actually, literally these folks, who went through these halls and told their stories to anybody in power who would listen over and over and over again.
Even to the ones who would.
And that's what's gonna win. That's what's gonna fight back against these insane increases to the Affordable Care Act.
Yep.
So right now I'd like to hear from Lauren LaRue from Pennsylvania, who's on the Affordable Care Act, representing the Economic Security Project.
All right.
Thank you, Lauren.
Thank you.
Good.
Yeah, get your sign, girl.
Say some things to him.
Yeah.
Say some things.
Thank you all for being here. My name's Lauren LaRoe. I live in Bucks County, Pennsylvania's 1st Congressional District, and I'm really happy to be here with you all today to share my story. I'm here because healthcare is life.
Yes, it is.
Access to healthcare saves lives.
Yes, it does.
It saves American lives. When I lost my job earlier this year, like a million other Americans in this terrible economy that we're struggling through,
Yeah.
I was faced with an awful choice of having to pay $15,000 a year to have COBRA coverage to continue the insurance that I previously had with my job. That's an unconscionable amount of money.
Yes, it is.
And I could only maybe have that for 2 or 3 years at best. But thank Obama, I could access the penny exchange, which is the Pennsylvania's Obamacare exchange. And with the enhanced subsidies, I was able to get health care at a fraction of that cost, which is huge. I mean, I just turned 45 last month, and getting my annual mammogram is super important to me. Breast cancer runs in my family. I need those screening services, and I need to have access to them. Next year, my overall rate is only going to go up about $120, but without the enhanced subsidies from the Affordable Care Act, my insurance premium is going to more than double next year. That's going to make it unaffordable for me. Prior to the enhanced subsidies, when I had my tutoring business, which I still have, I had to drop my insurance once they said you didn't have to have it because I couldn't afford it anymore. But after COVID and they enhanced the subsidies, I could suddenly afford it again, and it was amazing to be able to have insurance and to be able to take care of myself. And it's not cheap. I mean, it's still expensive. I still have to pay $7,500 out of pocket for, my deductible and things like that. But it makes it so much more manageable to have that, and we need that coverage. We need to extend these enhanced subsidies because healthcare is a right. And, as I get older, I shouldn't have to choose between taking care of my body and taking care of where I'm going to live. We shouldn't have to be making those choices.
That's right.
And this idea that there isn't any money to pay for these subsidies or that, non-Americans are getting them is an absolute lie.
Lies.
There's tens of millions of dollars to send Trump to Mar-a-Lago to go golfing.
Yes.
There's hundreds of millions of dollars to build his gilded ballroom.
Yes.
There's billions of dollars for ICE to terrorize our communities.
That's right.
There's tens of billions of dollars for, wait for it, Argentina?
That's right.
And there's $1 trillion for billionaires who don't need it? Save me with your we can't afford it. And we need to make it, tighter so that it'll last longer. Cutting people off of their insurance isn't going to make this country better.
Right.
It's time to fund the Affordable Care Act, keep it intact, and keep these enhanced subsidies in place so America can stay healthy.
Yes.
Thank you.
Thank you.
Save the ACA.
Save the ACA.
What?
Save the ACA.
What?
Save the ACA.
What?
Save the ACA.
What?
Save the ACA.
Let's keep hearing these stories because after this, we're going to walk through the halls and we're going to confront Congress members and we're going
right.
to share the stories that we're hearing. So I'd like to hear from Barbara Harris from Florida to tell us her story. She's on the Affordable Care Act.
I'm right here.
Oh.
Yeah. Barbara.
Hi. Hi, everybody. I'm Barbara Harris, and I'm actually not on the ACA, but I have family who is. I'd like to tell you a little story. My husband works for Disney. He makes $25 an hour. He's been there for 27 years. Not even $1 an hour is he worth. That's Disney. Disney, along with Walmart, Amazon, and the rest of the trillionaire people, have the most people on the ACA, without insurance, on SNAP.
Yes.
All these businesses that are like trillion-dollar businesses,
Come on.
and their people have to go to the government to get health care and to get SNAP,
Not
to be able to eat.
That ain't right.
Our health insurance last year, my husband pays almost I think it was $179 a week through Disney, private insurance. This year it went up another $70. In order to pay just our health care of almost $1,100 a month, which we can't go without. I have stents in my heart. I am disabled. I have a really hard time walking. If I didn't have him, I really don't know where I would be. I'm assuming one of my daughter or one of my grandkids would be caring for me. I worried a month ago he went down. We were sitting in our living room watching a movie, and all of a sudden he just passed out. I haven't even discussed this story. And I was terrified. I was terrified for him. And then somewhere in the back of my mind, I was terrified for myself. Thinking, if something happens to my husband, how will I survive? He works 80 hours a week, people, 80 hours a week to pay for our health care. My daughter and my grandkids are on the ACA. They will lose it. It's going to be gone. We live in Florida. 4.3 million people will be thrown off of Medicaid, and 3.4 million people will be thrown off of the ACA plan.
That ain't right.
He never decided to expand ACA because, you know, he's evil. I'm not even going to say it another way. So we have to do this. We must. We should be covered when we're sick. It is inhuman that a country as rich as ours, and don't tell me we're not rich. Don't tell me. I don't believe it. I will never believe it. We should be caring for the least of us. The least of us should be able to eat, to go to the doctor, to keep a hospital in your city, your town. You shouldn't have to drive an hour in Florida in a rural county to be able to get a doctor. By the time you have a heart attack and you get there, you're dead. That's just the way it's going to be in Florida. So I am going to walk those halls till my leg doesn't move. I am going to fight this fight until they bury me in the ground. Until they bury me, because my grandchildren matter. They are somebody and they matter. So fight. Keep fighting. Don't give up ever. Keep fighting. Thank you. Save the ACA.
Save the ACA! Save the ACA! Save the ACA! Save the ACA! We're fortunate enough to have a fighter in Congress who is here today to talk to us about what she is doing to make sure that these MAGA Trump sycophants get off their ass and actually save the Affordable Care Act.
Say that again.
It's my honor to introduce Congressmember Gwen Moore from Wisconsin.
All right,
Well, good morning, advocates.
Good morning.
You know, one of my colleagues pointed out some time ago that people really didn't understand the ACA. That they really didn't get it. They get it now.
Yes, they do.
I've seen grown men cry when they got their premium tax credits, their ACA bill, and what their contribution would have to be. I've seen grown men cry.
That ain't right.
You know, my granddaughter, who left her good government job to become an entrepreneur, is trembling now because her costs have gone up from an affordable $150 a month to now almost $1,000 a month to have health care. And as we speak, today, she is having brain surgery. She's not a person who can do without health care. And just let me say this. This lie that Republicans try to perpetrate, that the ACA is being abused, and people are making $600,000 a year and getting these premiums. Lie! 94% of these premium tax credits go to people who make under $200,000 a year. This is no longer an abstract effort on people's parts. You know, I was sitting there, I'm a member of the Ways and Means Committee. And so right now, behind closed doors, Republicans are because they know they're in trouble. They know they're in trouble now because this is no longer abstract.
That's right.
People are just really not as stupid as they think they are. I mean, people know basic arithmetic. They know the difference between $1,000 a month and $150 a month. They get that. So what they're doing now is to try to make this big push for HSAs. health savings accounts. These health saving accounts have $1,000 in them, the average one of them. Not enough to get you a Band-Aid in the emergency room, much less health care. That is not an alternative and an option to having health care. The last point I want to make is that some of us are fortunate enough to have health care through our employers, either through government, through our union contracts, through the private sector. But 40% of us are working for small businesses, are entrepreneurs, working for nonprofits, and we do not have health care through big corporations.
Right.
These are the people, not some little boy who's sitting in the basement playing video games, calling up the stairs, asking his mom to bring him some potato chips. That's another lie. And in my state, more than 250,000 people will be impacted. And when you put that together with the $500 billion cut in Medicare, and oh, by the way, Medicare payments are going to be an additional $200 a year. Just saying. I know this ain't the topic of this meeting. But just saying. True. The $1 trillion cut in Medicaid. Come on. Okay? And the lapse of these affordable care these premium tax credits. This is 20% of our economy, y'all. The healthcare system. The Chamber of Commerce should be out here with us standing in the cold.
That's right.
So we're standing in the cold today because Republicans are got us out in the cold on health care. Let me just say this, y'all. It ain't over until it's over.
That's right.
You know, and that is why Democrats are so glad to be back in session.
Yes, they are.
Because we're going to spend every single minute talking about this issue.
They're
having a hearing today over that's why we're on the Senate side, right? Y'all going over to the Senate? Right. We're going to put pressure on both houses.
Come on. Pressure.
And on the President of the United States to do right.
That's right.
By people. What does Seeley say in Color of Purple? What's been done to you, what you think you doing to us, gonna be done to you. And until you do right.
That's right. You do right.
Until you do right. All right, y'all.
Thank you.
Thank you so much.
Save the ACA!
What?
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 Thank you.
Thank you so much.
Thank you.
Congresswoman Moore.
We're facing these insane increases to the Affordable Care Act on top of Medicaid cuts. The biggest Medicaid cuts that we have ever seen, the biggest gutting of our healthcare system that we have ever faced. And it's already having real-world implications. People are already losing their health care. And we're going to hear from Asia Betancourt from Vocal New York, who's going to talk to us about Medicaid cuts.
Come on, girl.
Yeah, Asia?
Yes. Thank you, Asia.
I'm honored to be here, and I'm goddamn pissed. Okay, I've been in this fight 40 years. 40 whole years. Let me start how I'm supposed to start. My name is Asia Betancourt, and I've been a community advocate on Staten Island for 40 years. I was there when when we won the ACA. We got access to care. I can't tell you how happy people were. It was like, for the first time in my life, a smile in my heart for society.
Yes, it was.
That we mattered. Because to me, health care is a human daggone right.
That's right.
Okay?
Yes. That's right.
These cuts from the ACA are literally killing our asses. Excuse me, our butts. Everything has gone up. My premium, my co-pay, my deductibles. The cut to the medication that I've been on for 40 years. All of a sudden, the quality of my life was good, and all of a sudden, they said, we're cutting your medication in half. That was maybe 6 months ago. I've lost 50 pounds because of it.
That ain't right. Not right.
You gave us coverage to improve the quality of our lives. Now you're going to take it away.
Yes.
I'm HIV positive. The changes they're making to people who are HIV positive, you're going to need to be really sick to get any help. You hear that? Yep. You have to get sicker before they'll do anything for you, and that's just maybe.
Wrong. It's wrong.
What does this mean for all of us? The stigma of this disease, what it does to our communities. Yes. I'm so thankful to be alive here 40 years later, but I've seen a lot of people die on that ladder coming up.
Yes.
And now they want us to suffer more before we qualify to even get service to somebody who's newly diagnosed with HIV. I would go to the doctor more if I could. These cuts have been devastating. It's gradually going to pull the rug from under us.
Yes, it
they
is.
keep cutting away at different parts of the programs, a little here, a little there, and then suddenly you can't afford your medication. You can't see your doctor. You can't get the care you need.
That ain't right.
Listen, when the hospitals are scared to book appointments, which is happening right now, because they don't know how and when they're going to get paid, how can you make a business run like this? How can they take care of us? This is the collapse of our medical system. There is no more gas left to run, baby. There are too many people who are sick and don't have a voice. They can't be here today. They are dying in the shadows while Congress protects billionaires and the corporation instead of protecting us. The rural areas that depend on a little bit of help from the ACA and Medicaid, they're going to lose everything. This is our daggone lives on the line.
Yes, it is.
And we have to fight back. Fight. Healthcare is a human right. Fight. Healthcare is a human right. Fight.
Thank you, Asia.
Thank you.
Thanks, Patrick. Now we're going to hear from the president of National Nurses United, who is herself a registered nurse, Mary Turner.
Yes.
Yeah, and then you.
All right.
Thank you.
Hi, guys.
Hi.
How are you?
All right.
Take that jacket off.
Get ready. First of all, I'm from Minnesota, and we laugh at weather like this, all right? We laugh at weather like this, okay? Yeah. Try doing a picket in 40 below weather. So there you go. Done it. All right, anyway. Like I said, I'm Mary Turner. I am president of National Nurses United. We represent 250,000 nurses across the nation. But more importantly, I am still a working ICU nurse in Minneapolis, Minnesota. I work the night shift. Anyone work the night shift? Yay, night shift. All right.
Thank you.
Yeah.
Thank you for being here.
I was a COVID ICU nurse all the way through, and I remember the day when President Biden was the first president ever to publicly say that health care is a human right.
It's a human right.
That is the first president to say that. 2010, I saw the ACA become enacted, and we immediately saw our patients be healthier.
Yes.
Okay? That's because tens of millions, well, through the years, have been able to get preventive care. They've been able to get their medication. But I'll tell you what, very soon, 21 million people will lose health insurance. And I'll tell you what that's going to do at the bedside. More and more, the story that you're given, you're always given an update as to why a patient came in to the ICU. And more, it starts with patient found down. Yeah. You know what that means? It means that person couldn't afford to go to the doctor, couldn't get preventive care, and now they have collapsed wherever it is, the streets, their home, and they are being brought into the emergency rooms and going right to the intensive care unit where it is the most expensive care that you can receive. Okay, guys, that's the problem with this. You talk about healthcare costs and wanting to contain costs, it will go up because we can see the day where we will have mega ICUs. Because that's what we're going to need. Yes, we're not going to need the little med-surg beds. We're going to need mega ICUs to be able to handle the amount of people that will collapse and be brought into an ICU like mine. All right, that's not right, guys, okay? That's not right. And what are some of the reasons? Our insulin. We had a story about that one night that I took care of two patients that had a diabetic crisis because they had collapsed and they had been intubated. Well, one of them, we'll call him Harry. He was extubated, and I said, Harry, what's the problem? Why weren't you taking your medication? And he says to me, he goes, in a very defeated voice, he says, well, Mary, I ran out of money. So he had collapsed. He ended up in the ICU, intubated. The second person, he had health insurance. He could afford his insurance, his insulin. But he was giving half of his insulin to his diabetic son who didn't have insurance so that he could live. He ended up in the ICU. See, these are just two examples of what the lengths that our patients are going to have to go through. Okay, but I'm here to tell you that as nurses across this country, we stand with our patients. We will stand behind you to support you. We will stand alongside of you to advocate for you. And if need be, we will stand in front of you to protect you. Because that is what we do. And I'll tell you what, somebody said they're pissed. Well, there's nobody more pissed than a person who, somebody or some government that gets in between a patient and the nurse. Nobody gets in my way or the nurse's way across this country if you're going to jeopardize the safety and health of our patients. Those are fighting words, and we, as an organization, militant nurses, every single one of us. We will not stop until we have. And you know what the answer is, folks? Somebody mentioned it. I'm not going to beat around the bush. No, Medicare for all. Medicare for all. All right? So I've said what I had to say because, I'm the nurse and I'm freezing now. You gotta say you betcha.
Thank you.
You bet. Oh yeah. You betcha. You betcha. You guys are funny. But anyway, thank you for having me.
We appreciate you. Thank you. Save the ACA. What? Save the ACA. What? Save the ACA. What?
Save the ACA.
What? Save the ACA. What? Save the ACA.
So we're facing these insane increases to our Affordable Care Act premiums. We've heard that there have been the largest cuts to Medicaid ever. And before that, remember the first thing that they did was they had DOGE, and they came in and they fired all the federal workers and destroyed all the agencies. We're going to hear from Charlotte Simon from the Federal Unionist Network.
All right.
Hi, thank you.
Thank you,
Hello. I'm Charlotte Slayman. I'm a proud union member with NTEU, Chapter 344. I'm an organizer with the Federal Unionist Network, or FUN, and I'm an antitrust lawyer at the Federal Trade Commission. I've been a federal worker for 5 years and served under 3 presidents. I'm here in my personal capacity today as a citizen and as a member of the community here in Washington, D.C. The Affordable Care Act is a crucial pillar of our community's health. We rely on the ACA to make sure that the people we interact with in our community every day are getting the health care they need. In any community, we rely on each other's work.
Yes, we do.
We rely on each other's safety precautions, and we rely on each other's health. For many federal workers, ACA subsidies are a kitchen table issue, even if we aren't currently using them. Another fun organizer wanted to share her story with you here today, but she's unable to join us in person due to her chronic illness. She was one of the thousands of hardworking civil servants who was wrongfully terminated earlier this year as part of DOJ's illegal purges. Facing shame. Facing the loss of both her income and health insurance was terrifying. She has long COVID, and her high out-of-pocket health care costs would rise to unmanageable levels without insurance. At the time that she was wrongfully terminated, she was trying to get a wheelchair. With insurance, she knew that the chair would cost about $500. If she had lost insurance and been unable to afford an ACA plan, the chair would have cost almost $5,000.
Damn, that ain't right.
Fortunately for all of us, this federal worker was reinstated to her job. Yes. So her important work for our nation can continue, as well as her health insurance. But as we know, tens of thousands of other federal employees were not reinstated. And we fear more illegal firings to come. These attacks on federal workers across the government and across the country have meant that federal workers have had to rely on each other this year more than ever before. The jobs that we thought were good, reliable, fulfilling jobs are suddenly none of those things. The solidarity that we have built this year is what I am most proud of. And I think President Trump feels very threatened by that solidarity. That's why he's doing everything he can to undermine it, to pit people against each other by creating false choices. According to President Trump, we can only have SNAP benefits for hungry families or affordable health care.
Can't get both.
Lies. Federal workers can only get our jobs back if Congress sells out the ACA. Our economy can only have enough good jobs for everyone if we allow masked ICE agents to kidnap innocent people off the streets. These are false choices.
They are false.
They are meant to tear us apart. Because we know and they know that we are stronger together.
Yes, we are.
It's critically important that Congress extend the ACA subsidies that millions of Americans rely on to be able to access health care. We need healthy communities so we can all thrive. To say we can't afford it is a false choice. Thank you.
Thank you.
Save the ACA!
What?
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 We heard earlier that, you know, there's really no choice here. You're either, you should just support people getting health care. It is actually just the right thing to do. We're going to hear from Network Lobby for Catholic Social Justice, Laura Peralto Schudel, the Senior Director of Public Policy. Hi.
Hey, so nice to have you here. Okay, I don't know about you, but I felt like I was in church when I was hearing some preaching. So my name is Laura Peralta Schulte. I'm with Network Lobby for Catholic Social Justice. We were founded by Catholic sisters 53 years ago, many of whom were those nurses in different hospitals to educate, organize, and lobby for justice for everybody. So our faith tells us that health care is a human right.
Yes, it is. Right.
And that it is not a privilege for those lucky enough to be able to afford it. So we are so excited to be gathered here today with sisters and brothers like Asia, who are agonizing over the choice of whether or not they will actually be able to have health care next year. This injustice is staggering, my friends, because we know we live in the wealthiest nation on the planet Earth.
Yes, we do.
This health emergency, as many of us have said before, was created by the Trump administration and his friends in Congress. who are making this crisis worse. They have continually prioritized the interests of the rich over the rest of us. And that, my friends, is immoral. They paid for permanent tax cuts for their billionaire friends, making devastating cuts to health care and food to pay for that bill. They callously and intentionally chose during that bill not to extend these health-saving tax credits. Then they refused to even have a discussion about fixing this problem as a part of the shutdown. And now, many of you here today and 12 million others just like you must decide whether they can have health care they need to live next year. And friends, that is wrong.
That's right.
We deserve a lot better, and that's what we are demanding right now. Now listen, friends. Many of these members of Congress in these hallowed halls tell us they are followers of Jesus. Jesus, who lived among the poor. Jesus, who healed the blind and the sick. Jesus, who commanded us to love our neighbor, just like the Good Samaritan who provided health care to a stranger found near dead in the middle of the road. Jesus said, whatsoever you do to the least of my sisters and brothers, you do to me.
That's right.
And friends, we in the faith community take that very seriously. Providing health care is sacred. It is sacred. It is sacred, and it is right. Empty promises and endless delay threaten to be a death sentence, as we know, for thousands who desperately need care. So we in the Christian community want them in the Christian community to remember what St. James told us. Faith without works is dead. So in love, my friends, in love, we demand that they fix this problem right now and save the ACA. Thank you very much.
All right, let's keep going to church. Save the ACA. Save the ACA. We're gonna keep going to church. We're very lucky to have with us today the Chief Operating Officer, Reverend Dr. Leslie Copperland Toon from the National Council of Churches.
Thank you. Good afternoon. I believe we're in afternoon now.
Yes, we are.
In my tradition, we say, this is the day the Lord has made. Let us rejoice and be glad. And we are certainly glad to be here together because we're standing up, we're speaking out, and I believe we're doing what God calls us to do in a moment like this. The National Council of Churches represents 37 member denominations, everybody from mainline Protestant, United Methodist, Evangelical, Lutheran, Presbyterian, the Episcopal Church, historically African American congregations like AME and AME Zion and National Baptist, living peace traditions, and also a whole family of Orthodox churches. So there's about 100,000 congregations and about 30 million people within the membership of the National Council of Churches. And we stand to, there's a lot of things we do not agree on. Amen. Amen. But what we do agree on is that we are called to care for the most vulnerable in our society. From Genesis to Revelation, there is God telling us over and over, our scriptures are telling us over and over and over again to care for the poor, to care for the least of these, to care for the most vulnerable. Proverbs 22:22 says, do not rob the poor because they are poor. And the truth of the matter is that all of us are in jeopardy with these health care cuts of being in a vulnerable position. None of us can go without health care. And what happens to one really, truly impacts all of us. You know and have heard, and it has been quoted already, what Jesus says in Matthew 25:36, I was naked and you gave me clothing. I was sick and you took care of me. And the thing about, if you read that whole context of Matthew 25, because so many people people, some to the left of us, they want to just cherry pick what it says and how it says it.
That's right.
But if you read that in context, it's not just talking about individuals. It's talking about nations.
Amen.
That nations are supposed to care for the sick. Nations are supposed to care for those who are hungry. So we are here today again because our health care is on the line. And one of the things that really bugs me about this is that we know because of the cuts from the big, brutal budget bill that passed, we know that 51,000 preventable deaths may happen because of the cuts to Medicaid.
Yes.
We know that even with food, that they cut $186 billion from SNAP. And we're here because they're telling us that they have room, there's money for Argentina, no shade to Argentina. There's money to give tax cuts to the wealthiest, no shade to the wealthy. There's money to build a ballroom so that there can be parties, but there's not money for food, there's no money for SNAP, there's no money for health care. I want to call you a liar. I want to say that the truth is not in you. We want to be called a Christian nation, and yet we won't do the very minimum of what Christ calls us to do. And that is not only a shame, it is a sin and a shame. And where there is no shame, there has to be accountability. And so we are gathered because we must resist, we must persist, and we must insist that ACA is saved, that we have health care, that our hospitals are saved, that our nurses are covered for all the great work that they do for us. For ministers and pastors, we have to journey with families that lose their loved ones because of preventable diseases. And if you think it's hard to figure this out, it's tremendously traumatic to have to journey with a family through the loss of a loved one, to have to funeralize them, to have to go to the hospital from things that they know could have been prevented. So we come and I think about Martin Luther King, who said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. But listen, we're not going to just be shocked. We're not going to just be startled. We're not going to just be mad and upset. We're going to put our words in action. We're going to put our belief that health care is a human right to work for us. We're going to register people to vote. We're going to get people out to vote. We're going to let them know that if you can't vote for health care, we can't vote for you. And we're going to put them on notice that come next year, they might be out of a job, and we're going to make sure of it. So what was that? Fight, fight, fight. Health care is a right. Fight, fight, fight. Health care is a human right. Fight, fight, fight. Health care is a human right. And let me just, I come from a Baptist tradition, and I just feel led, if you will just join me in just a quick, brief prayer. God, we thank you for this gathering and this time of standing up and speaking out for the most vulnerable. God, we ask that every word that has been said would find good soil, that seeds have been planted, oh God, that our voices have been heard, not only for those we are caring for and sticking up for, but for members of Congress, oh God. Many of them say they believe in you, but act like they don't. So we ask, God, that you would turn stony hearts to flesh, that you would change their minds and their hearts and have them not just talk right or think they're talking right, but to do right by your people. And we trust and believe that even now you're working things out on our behalf. Even now, oh God, you're moving us from being stationary and from being silent to speaking out. And you're moving them, oh God, from being on the wrong side of you and of history to being on the right side and doing what is right, what is just, what is merciful, oh God. So we thank you in advance, and we count it joy and done in your name. Amen.
Amen. Amen. Amen. Thank you.
great speakers. We've gotten a lot of great information, but I want these, we're in the home stretch. There's 3 more speakers, and I want you all to take out your pen and paper or your notes app on your phone, and I want you to listen and remember what these next 3 speakers are going to tell us, because we are going to share their stories to anyone that we see in Congress this afternoon, okay? So I'd like to call up Deborah Davis from Rights and Democracy in Vermont.
Yes, girl.
Thank you. Okay.
Let's go, Deborah.
All right. Let me just pull it up here. Good morning.
Good morning.
And thank you for giving me the space to speak today. I'm here not to just advocate as a grandmother and a mother, but as a community leader. I'm here as a Vermonter who refused to stay quiet while tens of thousands of our neighbors are pushed to the edge of losing health care. Right now, up to 45,000 Vermonters, yes, 45,000, could lose their health care coverage because of cuts to the Affordable Care Act. The number is not abstract. It is not distant. It is not theatrical. It is real people. It is us. There are people who bag our groceries, the people who care for our elders, the single mothers rushing to work at 5 a.m., the dad standing in a line at the pharmacy not knowing if his card will go through, the seniors choosing between insulin or electricity. This is Vermont we're talking about. And in Vermont, we take care of our own. And let me bring this even closer to home. I came from Burlington, a city full of hardworking families who are already stretched thin by rent, inflation, and the cost just to survive. If these ACA subsidies disappear, hundreds of Burlington children will be at risk, because when parents lose coverage, kids lose stability, plain and simple.
Yes, that's right.
Teachers will feel it. Pediatricians will feel it. Counselors will feel it, because untreated asthma turns into ER visits. Untreated anxiety turns into school absences. Untreated illnesses turns into crises that could have been prevented. When you talk about taking coverage away, you're not talking about policy. You're talking about children with inhalers, parents battling cancer, people in recovery, and families who just need one medical emergency covered so their entire world doesn't collapse.
That's right.
Vermont has one of the highest coverage rates in the entire country, because we believe that health care is a right, not a privilege. We believe that every child deserves a chance to grow up healthy, not punished because of their parents who can't absorb a sudden premium hike. And I'm standing here today to make something very clear. We cannot go backwards, not now.
No.
Not after everything we've survived.
That's right.
Not after we fought tooth and nails to protect our families during a pandemic that exposed just how fragile our safety nets are.
That's right.
Cutting ACA subsidies doesn't just leave people uninsured, it leaves them unprotected, unseen, and unheard. It will tear at the heart of communities like Burlington and the world. It will devastate families across the state, and it will hit children the hardest. Because children always pay the price when adults lose coverage.
Yes.
So I'm asking everyone listening, policymakers, leaders, decision makers, to remember this. Vermont is watching. The world is watching.
Yep.
Families are watching. Our children are watching. We cannot turn our backs on them. We cannot allow 45,000 Vermonters to be pushed off a cliff. We cannot let health care become a luxury in a state that prides itself on compassion and common sense. Protect the ACA. Protect the subsidies. Protect our children. Protect our elders, our workers, and our communities. Because in Vermont, we don't leave people behind, and we damn sure don't take health care away from children.
Yes.
Thank you.
Now we're gonna hear from someone who fought really hard to save the ACA in the first Trump administration. We're gonna hear from Donna Davis, who's on the ACA from Popular Democracy in Florida. Woo! Donna.
so hopefully I don't cry. I've been crying all morning.
It's okay.
Can you give us
Cry
this?
away.
Okay. Because I am sick of this shit, frankly.
Look at it.
Right? I'm tired of coming up here and fighting for basic things that we should have. If the corporations aren't paying taxes, if they're not paying us, what are they doing with the money?
Yes, that part.
Okay. Just had to get that one out. Now, I'm standing here today because something has gone terribly wrong with what we call affordable care. My Affordable Care Act premiums are about to jump from $870 a month, which I was kind of okay with because I was getting most of what I needed. But that's going to turn into $1,300 starting on January the 1st. Now, that's not a cost of living increase. That's not inflation. Okay? That represents a 50% increase in a basic necessity. And it gets worse. Not only will I be paying dramatically more, but I will be getting less. On my current PPO plan, a colonoscopy is covered, preventative care, right, at 100%. But if the doctor finds a polyp during my colonoscopy, that is covered at 0%.
I know that.
So what's the point of the colonoscopy?
Right?
Okay.
True story.
This year, my annual CT scan and calcium score, because I have early onset heart disease, I am 54 years old, was a $2,000 out-of-pocket copay for a CT scan.
Disgusting.
That's on Florida Blue if you're interested. Don't do it. Next year, my coinsurance will be higher. And I need to say here that I am paying a total of just under $19,000 a year in cash for health care, right? And that is an estimate on the low end. Okay, I'm not rich. My heart medication is another example. My plan covers 45% of it. The full copay is $230 a month. When I was working in Minnesota, in St. Louis Park Costco, two lovely ladies, Laurel and Nicole, fought tooth and nail to get a manufacturer's coupon for me that took my Repatha, that stops the formation of soft plaque, as you well know. I see the nurse nodding. From $230 copay to a $15 copay. I'm going to move to Minnesota. I'm there like half the year anyway working. If you haven't been keeping track, my total annual cost for medical care is just under $20,000, and I'm just one person. Now, my spouse, on the other hand, is a disabled veteran, someone who served this country, who is fighting 2 active cancers as we speak.
Come on.
He requires weekly blood transfusions to stay alive, weekly. And we are still crushed by cost, buried under coinsurance, and navigating a system that seems designed to exhaust us rather than to support us.
Yes, that part.
You don't have to be an economist to understand the truth. When regular working people are paying a mortgage-sized bill for basic health care, something is deeply broken. Health care is not a luxury. Health care is not a privilege for the wealthy. Health care is not something you should have to fight for, beg for, crowdfund for, or go into debt for.
That's right.
If the system continues down this path, people will skip medications. People will skip preventative screenings. They will delay care until it's too late, found down, as we heard earlier. I'm raising my voice today, not just for myself, not just for my husband, and I need to add this in because I hadn't planned to talk about this, but a 26-year-old nephew in Colorado who was an engineer doing well for himself, Colorado School of Mines, we were so proud, passed away a week and a half ago, waiting on new medication to be approved. They should take 48 hours to do these approvals for asthma medication. And he died of an status asthmaticus, as it's known, right? And it took, worse, there was a failure on the part of the emergency systems because it took them 2 hours. He called 911. It took them 2 hours to find him.
Oh, Lord.
26 years old, promising a young engineer, dead. So, let me get back into this. Apologize. Okay. We deserve better.
Yes.
We demand better. And we are not going to speak out. I told IG this morning, he said, if you need a moment to step back. And I said, remember, us organizers and activists say, speak your truth, even if your voice shakes.
That's right. Yeah.
I'm exhausted, and I am mad as hell. But I am not going to stop coming up here on my old knees, climbing in and out of these lifts. I'm going to keep speaking. I'm going to keep fighting, even if my voice shakes.
Yes.
Thank you.
Thank you. Yes.
Our last speaker, Rachel Phipps, who is on the Affordable Care Act, who is from Maine People's Alliance, has a message for her senator. So I want everyone to listen. Write down these notes so that if we see Senator King in the hallways, we will share it for her.
That's right. Thank you.
Thank you.
Thank you.
Let's go, Rachel.
Hello. I'm closing this thing down, but we're moving on.
Come on.
Rachel Phipps, I'm from Kennebunk, Maine.
Yes.
I am married and have raised 2 children. I have worked since I was 16 years old. I have a master's degree in social work. In January of 2025, this year, when I was 63 years old, my mother was in hospice and dying. We all know how this country does with elder care, right? I was her primary caretaker. She lived alone. She didn't qualify for Maine Care, so I retired and began to collect Social Security so I could take care of my mom. My mom died in June with me by her side, and I wouldn't give that up for anything.
That's right, me either.
My husband is self-employed. He runs a woodworking business in Sanford, Maine. Over the years, he's provided a job for over a dozen people. I have always carried our family's insurance, employer-based insurance, through my jobs as a social worker. So when I retired to take care of my elderly mom, we had to apply for health insurance through the Affordable Care Act marketplace. This year, our premium that we paid, our premium was $2,120 a month without the subsidies. With the subsidies, we paid $200 per month, which we could just afford. Next year, our premium will be $34,403. And if you don't believe that, I have a picture from my insurance company right here. And the out-of-pocket will be more than $15,000 a year, bringing our potential cost for health care next year to $49,000. Again, I have a picture. I'm not making this up. My husband brings home $50,000 per year. I receive $17,000 for Social Security. So our health care costs, if we could afford them, would be 73% of our annual income.
Shame. Shame.
The ACA subsidies were intended to ensure that no family paid more than 10% of their annual income in health care. Since I have taken Social Security, I'm only allowed to earn up to $22,000 through employment without having to give money back. I just learned that when I retired. Therefore, at this point, I can't get a full-time job that provides insurance. If you do that, you have to give the money back. I don't have the money to give back because we spent it. Surprise, surprise. So I'm not able to get health insurance through an employer now. So Senator Angus King, independent from the state of Maine, I need you to hear this. If this Congress does not reinstate the ACA subsidies, my husband and I will go without insurance this coming year. We simply cannot afford it. If you could see my face clearly, some of you up close, you'll see that I'm being treated for skin cancer. I was diagnosed in October of this year. My follow-up appointment is at the end of December with my dermatologist. If I need follow-up treatment, which I probably will, she guessed, I will not get it. It will be January. I will not have health insurance. I might be one of the 51,000 people who you have heard will die this year.
Shame.
That could be me,
Shame.
Senator King. This big, brutal bill and the lack of ACA might kill me, leaving my husband without a wife and my beloved children without a mother. Mind you, I'm 63 years old. Please act all of you in Congress to reinstate the ACA subsidies for the 42 million other folks who have these same kind of stories, whose health is on the line. This is life and death.
That's right. Thank you.
Thank you.
Thank you. Thank you.
Save the ACA! Save the ACA!
Good job.
Save the ACA! Save the
All right, everybody, we're going to wrap this up. I want to thank everybody for coming out. Thanks to all of our partner organizations. We have a little bit of a to-do list. We're going to go into the halls of Congress this afternoon. We're going to share these stories. If you see a senator anywhere in this campus or over at Union Station, you're going to tell them to extend the ACA tax credits, to reverse the cuts to Medicaid, to pass a budget that lowers costs, protects health care, and invests in what working families actually need, which is health care, housing, food aid, clean energy, and strong public schools. Congress must stop wasting billions on private prisons, on ICE, secret police, goons, and other over-policing, and redirect those resources to health care, to opportunities for working people, and for dignity for all. Thank you very much. Save the ACA! 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 Thanks, everybody!
Good job, everybody. Great job.
We have lunch over at the church. Oh.